Bill Gates, for so long the world's richest man, who famously announced he would give most of it away and spend his time and vast resources on the world's poor. His foundation, worth more than $50 billion, run with his wife and investor Warren Buffett, has, with great success, targeted massive killers like malaria, TB and AIDS in the developing world. Yet as Mr. Gates' powerful friends gather in Davos, the latest warning that the Gates Foundation has become too powerful and may not be the force for good so many world leaders say it is. The study from the pressure group Global Justice Now paints a picture of the Gates Foundation partly as an expression of corporate America's desire to profit from Africa and partly a damning critique of its effects.
You could have a case where the initial research is done by a Gates-funded institution. The media reporting on how well that research is conducted is done. The media outlet is a Gates-funded outlet and maybe a Gates-funded journalist from a media programme, and then the programme is implemented more widely by a Gates-funded NGO. I mean, there are some very insular circles here.
Among the many criticisms, the idea that private finance can solve the problems of the developing world. Should poor farmers be trapped into debt by having to use chemicals or fertilisers underwritten by offshoots of the foundation? Private finance initiatives like the one behind this hospital in Lesotho, paid for partly by Mr. Gates' philanthropy, also come under attack. The repayments for this now cost Lesotho more than 50% of its entire health budget. Some aid experts have warned repeatedly that the focus on high-profile, headline-grabbing diseases undermines wider attempts by African governments to reduce the poverty that causes them.
They've not been interested with looking at strengthening the health system as a whole. What they've been much more interested in has been around the delivery of very specific interventions, albeit interventions that are important, but they've not considered the long-term requirements for sustainability and also the requirements for all the other diseases and interventions that are also important in parts of Africa.
Global Justice Now had this response from the Gates Foundation to its report.
The private sector has access to innovations, for example in science, medicine and technology, that can save lives. And we believe that the role of philanthropy is to take risks where others can't or won't. The good news is that by working together in this way, we've made incredible progress.
Supporters of philanthropy would argue that it can get past corrupt governments and produce results without having to go through the bureaucracy of the United Nations. But critics of Mr. Gates ask whether it's right that one foundation with more money than entire African countries should wield so much power and influence. Lawrence Lee, Al Jazeera, London.